Module 2, Applications of Epidemiology in Public Health. Lecture 1, Epidemiology and Communicable versus Non-Communicable Diseases. Epidemiology applies to both communicable diseases, those caused by infectious agents, and non-communicable diseases, such as diabetes, cancer, and heart disease. Communicable diseases require strategies such as vaccination, quarantine, and surveillance. Non-communicable diseases require strategies addressing lifestyle, environment, and long-term health risks. Both areas demand careful measurement, risk factor analysis, and prevention strategies. Lecture 2, Strategies of Epidemiology. The main strategies include surveillance, continuous collection of health data. Prevention, including primary prevention before disease occurs, secondary prevention, early detection, and tertiary prevention, limiting complications. Control measures, such as vaccination campaigns or smoking cessation programs. These strategies ensure epidemiology remains an applied science that improves real-world health. Lecture 3, Epidemiology of Communicable Diseases. Communicable diseases remain a major global health burden. Examples include malaria, tuberculosis, and influenza. Epidemiological methods are used to track incidence, study transmission routes, and guide control measures such as vector control, sanitation improvements, and vaccination programs. Lecture 4, Epidemics. An epidemic occurs when the occurrence of a disease is greater than expected in a given area or population. Examples include Ebola in West Africa and cholera outbreaks after natural disasters. Epidemiologists investigate sources, track patterns, and advise on containment strategies to prevent further spread. Lecture 5, Sexually Transmitted Infections, STIs. STIs are a major public health issue, affecting millions globally. Common examples include gonorrhea, syphilis, chlamydia, and human papillomavirus. Epidemiological approaches to STIs involve identifying high-risk populations, promoting safe sexual practices, improving access to screening, and ensuring timely treatment. Lecture 6, HIV and AIDS. HIV, or human immunodeficiency virus, is a major global epidemic. It attacks the immune system, leading to AIDS, acquired immune deficiency syndrome. Epidemiology helps in understanding patterns of transmission, identifying at-risk groups, and evaluating interventions. Key points include modes of transmission, sexual contact, blood transfusion, sharing needles, and mother-to-child transmission. Incidence and prevalence. Incidence measures new infections, while prevalence measures total cases. Diagnostic test, antibody test, antigen detection, and PCR test. Lecture 7, Prevention, Treatment, and Control of HIV/AIDS. HIV prevention includes promoting safe sex, voluntary testing, needle exchange programs, and prevention of mother-to-child transmission. Treatment involves antiretroviral therapy, ART, which reduces viral load and prevents progression to AIDS. Control strategies require public health education, reducing stigma, improving healthcare access, and continuous epidemiological monitoring. Lecture 8, Epidemiology of Non-Communicable Diseases. Non-communicable diseases such as cardiovascular diseases, cancers, and diabetes are now leading causes of death globally. Epidemiology studies risk factors such as smoking, diet, physical inactivity, and genetic predisposition. Public health strategies include health promotion, screening programs, and long-term management approaches. Lecture 9, Public Health Impact and Future Directions. Epidemiology is not static, it evolves with new challenges. Emerging infectious diseases, antibiotic resistance, climate change, and global travel all affect patterns of disease. Public health professionals must adapt by using new technologies, global collaboration, and rapid data sharing to address health threats. Module 2 Summary. In this second module, we explored how epidemiology applies to public health practice. We studied communicable and non-communicable diseases, epidemics, sexually transmitted infections, and HIV/AIDS. We also examine prevention, treatment, and control strategies. The lessons demonstrate that epidemiology is not only a science of disease measurement but also a practical tool to improve population health worldwide. Course conclusion. This course on principles of epidemiology and public health has provided a clear overview of the methods and applications of epidemiology. Module 1 introduced the basic foundations, study designs, measurements, screening, outbreak investigation, and demographic methods. Module 2 applied these principles to communicable and non-communicable diseases, with emphasis on epidemics, STIs, and HIV/AIDS. Together, these modules equip you with the knowledge to understand disease patterns, design health interventions, and contribute to improved global public health.